I am Dr. K.P. Poulose. I am working in SUT Hospital, Pattom, as the principal consultant in medicine for the last 35 years. And I was the professor of medicine at Medical College, Kottayam. I retired as the head of the Department of Medicine. My topic today is hypertension. And as you know, hypertension is one of the very common non-communicable diseases. And we know the hypertension is increasing day by day among the people. And no wonder it is, since it is related to diabetes, obesity, dyslipidemia, and other causes, your high salt intake. There is no wonder why hypertension is increasing. What I'm going to talk about, what about the prevalence of hypertension, the definition of hypertension, the risk factors of hypertension, the different types of hypertension, how we prevent hypertension, and the treatment for hypertension. These are the various branches which I want to talk. First of all, what about the prevalence of hypertension? You see, there are so many cardiological societies in the world: American Heart Association, American Cardiological Society, European Heart Association, International College of Cardiology. So many people have so many definitions. But the definition which I am going to give you is the one which I use because of my experience. I use for treating a patient with hypertension. Hypertension, normally, the blood pressure, normal blood pressure, there is a blood pressure when the heart contracts, which is called systolic hypertension. There's a blood pressure maintained when the heart dilates or relaxes. That's called diastolic hypertension. The normal blood pressure will be 120 systolic and 80 diastolic. Anything above is abnormal, but you can't call it completely hypertension. What I do think is, any person who is having a blood pressure above 140 systolic and 90 diastolic should be treated and with drugs or with other drugs. Anything below 140 but above 120, you can call it as pre-hypertension, because these people, unless you tell them the importance of hypertension, unless you tell them the complications of hypertension, unless you tell them the risk factors of hypertension, sometimes the pressure may go up, and if it is asymptomatic, this may lead to heart attacks, stroke, cerebral bleeding, and even death. That is the importance of the definition of hypertension. So anything above 140 by 90, you must treat. Anything between 120 to 140 systolic and 80 to 90 diastolic, it is pre-hypertension, just like you have pre-diabetes. And if you don't treat it properly, it may lead to complications. And do you think that anybody whose hypertension is getting treatment? No. There is a rule, ardent rule before, that is called 50, half rule, half or 50%. That is 50% of the patients with hypertension do not know that they have hypertension. And 50% of the hypertension who knows that they are hypertension only gets the treatment. And 50% of the patients who is getting the treatment do not get adequately treated. That is the status quo now. And according to the prevalence of hypertension, I can say from Kerala, on the basis of studies released by the government of Kerala, it is done actually by the ICMR, the prevalence of hypertension is about 44%, while the prevalence of diabetes is 23% among the adult population in Kerala. And when the risk factors of hypertension is, one is high salt intake, two is obesity. The prevalence of obesity in Kerala is also about 50%. And the abdominal obesity is even more than that. So whenever there is obesity, there is more heart, more is body surface, so that you have to pump more blood So the heart has to pump with a little more force, so the vessel will get hypertension. And what are the different types of hypertension? Before that, I will tell you what are the risk factors of hypertension. It can be congenital, hereditary. If it's a hereditary, it can be due to disease of the chromosomes. Adult polycystic kidney disease can produce hypertension. Then there is a condition called Little's disease, also genetic, which can occur and it will produce hypertension in the children. And many of the patients, about I will say 70, 80 to 90%, 80, 85%, they have no cause. They develop hypertension as you grow. That is called systemic hypertension. Systemic hypertension. But other causes which can produce secondary hypertension. That is about 15 to 20%. You can say that this may be due to kidney disease. It may be due to endocrine disease like pituitary disease, thyroid disease. Can put kidney disease is very important. Then comes the endocrine disease, and then you can get the renal. Kidney disease, the most important thing is that renal hypertension, glomerulonephritis. Then I told you about the polycystic disease of the kidney. So endocrine causes as well as the kidney causes are the most important. Although you can get secondary hypertension due to coarctation of the aorta. But in this, you get blood pressure, high blood pressure in the upper limb and normal blood pressure or low blood pressure in the lower limb. So these are the different types of hypertension. When you find hypertension in a child or a youngster, it should not be or need not be a systemic hypertension. It may be a secondary hypertension. And if it is, you have to investigate whether it is a remediable cause. Then you decide about the treatment. And depending on the cause of the hypertension, you decide the treatment. And depending on the hypertension, in youngsters, I told you, you have to explore secondary hypertension. In patients who are 50, 60 years old, it is systemic hypertension. And in elderly patients, sometimes the diastolic blood pressure is normal, only systolic blood pressure. And that is also dangerous. So it is called isolated systemic hypertension. Should you treat? You must treat. Otherwise, it is, you don't do, I told you, heart attacks, brain stroke, cerebral bleed. So you will get patients with hypercholesteremia. You can get blocking of the peripheral blood vessels, leading to gangrene. All this is so it must be treated. That's a definite rule. How will you treat for a pre-hypertension? For these patients, you must say you must reduce obesity and hereditary causes. If your family is there involving hypertension, you are likely to get hypertension, and even at an younger age. So, if there is a familial cause, systemic serial recording or periodical recording of your blood pressure is enough. And then patients with pre-hypertension, you must avoid obesity, you must reduce your salt intake, and regular exercise is a must. So these are prerequisites for every patient, whether it is a pre-hypertension or isolated systemic hypertension, systolic hypertension, or systemic hypertension. And treatment depends on the type of treatment, the intensity of the blood pressure, the cause of the blood pressure, whether it is associated with obesity, associated with the diabetes or cholesterol. And there are so many drugs in the literature. You can classify it in so many ways. And there are so many types of treatment, whether you should diuretic first or as angiotensin converting enzyme inhibitors or vasodilators or drugs acting on it centrally. Yes, there are various types. And in this instance, it is also better to know that the first drug which is used about 90 years, 60, 70 years back is Serpacil, which was discovered by Rustam Vakil, an Indian from the plant Rauwolfia serpentina. That was the first drug used in India, Serpacil, for hypertension. Never nobody uses because of the further complications. So selection of the drug for treatment depends on the doctor. It is none of you, to patient in it not, because some drug cannot be given in you. So for example, in gestational hypertension, is a variety you get in pregnant people where the hypertension disappears after pregnancy. In these people in pregnancy, there are so many hypotensives which cannot be used. So decision of a treatment depends on not on the patient but on the doctor. But it is your duty if your hypertensive if you have any risk factor hypertension, you have to go serially for testing whether you have hypertension and risk factors. If present, you must reduce the salt intake, regular exercise, and you must reduce obesity. So, in short, because of the prevalence, increased prevalence of hypertension in India, because of the associated comorbid conditions which can occur with obesity, with hypertension, like obesity, diabetes, dyslipidemia. All these parameters should be tested to find out whether there is comorbidity. And unless and until you treat the comorbidity, further complications can also occur. Number three, don't treat self-treatment. You must always go to doctor because so many drugs are there, so that so many complications are also there, or side effects are also there. Leave it to the doctor. And lastly, don't worry about it. Hypertension is not curable but controllable. You cannot just, unless it is secondary hypertension. If there is an adrenal tumor, you can get hypertension. If you remove the tumor, your blood pressure will reduce. But for isolated this systolic hypertension or systemic hypertension, you have to undergo treatment, and treatment has to be prolonged. But the drug is to be selected by the doctor and not by the patient. Thank you very much.